All right, well, this is a webinar sponsored by ICU-DDR. I'm Carrie Hopkins-Isles. I'm the Executive Director, and it is just my absolute pleasure to have Beth and Nancy here from the UCLA Integrated Substance Abuse Programs, talking about a subject that is very near and dear to my heart, about addressing compassion fatigue and promoting self-care. So I'm going to let them speak and tell you a lot more, and we will have time for questions, and I'm going to hand it over. Beth, I believe.
Great, thanks, Carrie. Good morning, or good afternoon, or good evening. My name is Beth Murkowski. I'm the Director of Training at UCLA Integrated Substance Abuse Programs and the co-director of the Pacific Southwest Addiction Technology Transfer Center, which is a training program sponsored by the Substance Abuse and Mental Health Services Administration. And I'm joined today by my friend and colleague, Nancy Roget, who is one of our ATTC partners based at the University of Nevada in Reno. So we're going to share some of our learning around the issues of compassion fatigue and how to encourage substance use providers to practice good self-care, especially at a time like this when we're mad dashing to the end of the year and have the holidays approaching. And so I'm going to turn things over to Nancy, and she's going to go ahead and get us started.
Thanks, Beth, and I'm very excited to talk about one of my favorite subjects. So next slide, please. Just as a reminder for everyone, and a reminder for Beth and I actually, is that we are committed as part of the Addiction Technology Transfer Center Network to use people-first language. And so throughout the presentation, you'll see us use terms like people with substance use disorders, and trying to stay away from language that continues to stigmatize people with behavioral health disorders. So next slide. Today, these are our learning objectives, and let me go over them for you. At the end of the presentation, participants will be able to identify components of compassion fatigue, vicarious traumatization, and secondary traumatic stress. You'll be able to name 2 of the 3 domains of burnout. You'll be able to recall 3 strategies that organizations can take to prevent and help staff members manage compassion fatigue, and identify at least 2 strategies to promote self-care, both in and out of the workplace, and access resources related to preventing and managing compassion fatigue. And actually, the learning objectives are a great way to demonstrate our outline for our presentation today. So we're going to talk about compassion fatigue, burnout, strategies that organizations can take. We have 5 tips for self-care, and we'll have resources and links at the end of the presentation. Next slide. So what is compassion? And so we'll be talking about compassion fatigue, but let's look at what compassion is. And according to the dictionary, compassion is the sympathetic consciousness of others' distress, coupled with a desire to alleviate it. And the dictionary goes on to say that it's different than empathy, but we'll be using that term empathy and compassion fatigue. But we really want to talk about compassion. And the piece that I think is most interesting is that only compassion impels and empowers people to not only acknowledge but act towards alleviating or removing another's suffering or pain. And really that's what we're talking about today when we talk about substance use disorder professionals or behavioral health professionals, about providing treatment and recovery support services. Next slide. So what is compassion fatigue? And I really like this picture because it's kind of like an empty gas tank. And that's what we're talking about here. Sort of our tank gets emptied as caretakers. Next slide. Here's the official definition of compassion fatigue, and the term was coined by Figley way back in 1995, and he said compassion fatigue is the emotional and physical fatigue experienced by professionals due to helping others in distress. Next slide. So this is, when we think about compassion fatigue, it's really like part of our job. And so we, as behavioral health professionals, we work with folks that are vulnerable and suffering, and we listen to pretty traumatic stories. And then how does listening and providing empathy impact us? And this is really different than other professional disciplines of being a behavioral health professional. And so there are emotional requirements of clinical practice that are just not required by other professionals. Next slide. And so it's now widely recognized that indirect exposure to trauma involves this inherent risk of significant emotional, cognitive, and behavioral change in the clinician. And so this is what happens when we work with folks. Next slide. And so clinicians take in some level of their client's pain through facilitating sessions, listening to stories, collecting data as part of their efforts to intervene and identify issues, and providing treatment services with kindness and empathy. Always kindness and empathy. Next slide. So these emotional requirements of clinical practice can lead to three different conditions: vicarious traumatization, secondary traumatic stress, and compassion fatigue. And all of this is supported by this actually growing body of empirical research. Next slide. So let's do the definitions. Vicarious traumatization, which, by the way, is a mouthful, refers to transformation in your cognitive schemes and belief systems resulting from engagement with a client's traumatic experiences. And so it can really impact your sense of meaning, your connection, identity, worldview. Let me give you an example. So if you are a clinician who's working with people who have experienced interpersonal violence, it may change your worldview. It may change your worldview if you're not careful from, wow, the world is not a safe place. If I look at all the terrible things that have happened to my patients. And so that's part of this vicarious traumatization that you get. You pick up some of the trauma from your patients. Next slide. So the other condition is called secondary traumatic stress, and this is more serious than vicarious traumatization. And it was defined by Figley as the natural and consequent behaviors and emotions result from knowing about a traumatizing event experienced by a significant other, and the stress resulting from helping or wanting to help a person who is suffering. Next slide. And so with secondary traumatic stress, it's really identical to post-traumatic stress or PTSD. And so you, just from working with clients who have experienced traumatic events, listening to their stories, helping to intervene, you may get some of you may actually suffer from the same kind of PTSD as if you had gone through that experience yourself. So this is some of the symptoms of PTSD: intrusive imagery, avoidance of reminders and cues, hyperarousal, distressing emotions, cognitive changes, and functional impairment. And you may be saying to yourself, really, just from listening or from helping or intervening? Well, yeah, some cases are that we work with are so severe that we do these deep dives into our interactions with patients, and it ends up impacting us, and we can't ignore that impact. It may not be as severe as having PTSD symptoms, but certainly we are impacted and we have to be aware of that impact. Next slide. And so compassion fatigue, Figley and his colleagues introduced this more user-friendly term, and it's really to describe the phenomenon of secondary traumatic stress. And there's some distinctions between these terms, but all three of the terms that I just went over refer to the negative impact of clinical work with traumatized clients. Next slide. And so what's the difference, as I just went over? Traumatic stress is extreme emotionality or absence of emotion. This is what clinicians may experience. Fearful, jumpy, exaggerated, startle response or flashbacks of the stories or the images of what the client portrayed. Vicarious traumatization is overly involved with or avoidance. So remember, it can go either way with the victim or survivor. Hypervigilance and fear for one's own safety. The world no longer feels safe. And intrusive thoughts or images or nightmares from victim stories. Next slide. So really what we're talking about here is the most insidious aspect of compassion fatigue is that it attacks the very core of what brings us as helpers to work, and that's our empathy and our compassion for others. So this drive to like, this is my life's work, this is what I want to do, this is what I've been trained to do, and yet there's a price to pay for that, and that we have to be aware and manage it. Nothing wrong with having compassion fatigue. It's about how we manage it, how we identify it, and hopefully how we prevent it. Next, Beth, I think you're next.
I am. Thanks. So compassion fatigue really can impact us at a variety of different levels. So some of the work that we're doing in California is to support some of the implementation of the opioid response money that came down from the federal government. And so another colleague of ours, Gloria Neely, she and I have done some workshops in California that really look at compassion fatigue and self-care in the context of the opioid epidemic. And so you'll see in some of these slides that we refer to opioids specifically, but it's not to say that compassion fatigue just arises from folks who are working with people who have an opioid use disorder. But if you look at the way that compassion fatigue can impact us as a community or as an organization, we'll start globally at the community level, and then we'll drill down to the individual. And so compassion fatigue at the community level can really be fueled by a variety of different issues, whether it's increases in overdoses as a result of the nationwide opioid epidemic. With COVID and the public health crisis that we've all been experiencing since the spring, we've seen depletion of financial resources. We've seen a requirement to completely shift the way that services are provided. We've also seen, because dollars have to be rerouted to really deal with the COVID-19 pandemic, we're seeing decreases in funding for substance use disorder prevention services or treatment or recovery. But there are other factors at the community level that really do happen because of compassion fatigue. So some of the consequences at the community level of compassion fatigue, there could be increased stigma for persons who have a mental health disorder or a substance use disorder. There could be a decrease in the belief that recovery is possible. And there also may be a decreased interest in supporting prevention and treatment programs, just sort of due to this global issue of compassion fatigue. So if you drill down one level to the organizational level, what happens? So some of the organizational consequences of compassion fatigue could be quite serious. So there could be loss in productivity. There could be, which could then in turn result in a lower quality of care for the people that we're providing treatment to or services for. We see increases in the rates of staff turnover and just a general sense of poor morale. People are just not happy with the work they're doing. They're not happy with the way that they're being treated by the organization, And it all is interconnected, and it really can impact negatively the care that we're providing to others. So drilling down one more level to the individual, so us as providers and us as human beings, what can happen to us as a result of compassion fatigue? Well, there could be an increase in health-related problems. There could be a desensitization to the work that we're doing, or there could be sort of this general sense of hopelessness or helplessness, which, again, will impact the quality of care that we're providing to others. So there's a few slides that we're going to present on the issue of burnout, and I know some folks avoid the term burnout because of the negative connotation that it has, but there has been some recent research, and the research that's being done is really using the term burnout, so we're honoring that in this presentation when we talk about the impact of burnout as a specific phenomenon and what happens to organizations as a result of that. So what is burnout? So it's basically it's the influence of the stress that is associated with working with clients who have mental health disorders, substance use disorders, physical health conditions. But it's also there's also a connection between when burnout occurs. There's this connection or this relationship between the person who's experiencing the burnout and the agency by which they're employed or through which they're employed. So it's that connection between the individual provider and their place of employment. And there's really those three distinct domains with burnout. There's an emotional exhaustion, there's a depersonalization, and there's a reduced sense of personal accomplishment. So what I'd like to do on the next slide is drill down into each of those things just a little further. So with regards to emotional exhaustion, there's a depletion. So you as a practitioner experience a depletion because of the needs or the demands or the expectations. And those expectations could be from clients, they could be from your supervisor, or they could be from the organizational leadership overall. Another way to think about depersonalization is cynicism is sort of another term to describe the issue of the phenomenon of depersonalization. But it's really, it's a negative or it could be a negative or an excessively detached response to either your coworkers or maybe your clients or patients and the situations that they're presenting with. And then the third sort of domain of burnout is that reduction in your sense of accomplishment. So you may feel inadequate when your patients are not responding to the brilliant interventions that you're implementing, despite your efforts. So you start to feel that no matter what you're trying to do to help others, you're feeling like it's not enough. You're not adequate. It also, there also may be an issue or a feeling of being overwhelmed by the constraints of the organization or maybe the bureaucratic or administrative demands. So you get weighed down by the institution that in which you're providing the care, and when you don't feel as if you're making a difference, it makes it so difficult to enjoy the work and to show up every day. So it's, all three of these domains really go into that overall issue of burnout. Okay. So when organizations don't address compassion fatigue head on, there's a lot that can happen. So there's this overall sort of loss of potential, right? There's missed opportunities. But it really falls into three areas. So there could be lost productivity, right? If your employees are experiencing compassion fatigue, they may have decreased morale. There may not be good cohesion across your employees. There could be poor communication or less collaboration than usual, which all goes into a reduced quality of service. If you look at the health of the organization, that really is related to the people that are working for the organization. So if there's a decrease or an erosion of your staff's concentration or their ability to make good decisions, that can play into that overall loss of potential. And then lastly, if you're not happy with the work you're doing, you're more likely to leave. And so there could be issues of increased staff turnover, and being a manager and having the responsibility of training new staff, it is incredibly time intensive to train new people to join your team. And when you're constantly in this sort of state of flux where you're losing staff and having to hire new people, it's incredibly time consuming, and it really can take away from the rest of the work that you're there to do. So why should we be concerned? Why is burnout concerning? So there has been some research done looking at turnover in a variety of different industries or organizational types of organizations. And if you look at the workforce data around the turnover rate for counselors, so behavioral health or substance use disorder counselors, it's about 33%. That's the average annual turnover rate. So 1 in 3 people are leaving the organization in any given year. If you see, well, that's just a number, so how does that compare to other industries or other types of work? If you look at teachers, for example, the annual turnover for teachers is 12%. If you look at the annual turnover rate for nurses, it's about the same, 12%. And one of the things that's most concerning about turnover in the behavioral health profession is that it's not as if the person's just leaving your organization because they're not satisfied. They're leaving the field, and so we're losing people altogether. They're going elsewhere. They're leaving the behavioral health field, and they're going into a different type of work. And it's more than 1 in 3 in that area. So lots to be concerned about, and there is a lot that we can do to try to reverse that troubling trend. So Brindley, there's some brand new research looking at burnout, and here's just some of the distillation of just some of the new thoughts around the issue of burnout. So it is the case that some people thrive no matter what. They have an incredible level of resilience, and nothing can shake them. And so some people won't experience burnout in their professional lives. They'll just keep chugging along, and they'll be able to take what is thrown at them, and they'll be successful no matter what. If you look at modern life, if you look at what it's like to live in the world in March of this year, life is really, really difficult right now. And it's not just working in the healthcare system. It's just living life right now is super stressful. Every day we wake up, we have to make decisions about our children in school and about if we're going to go to the grocery store or are we going to do home delivery. Like there's low level of anxiety that's been thrown at us with the COVID-19 public health crisis, and it's just difficult. It's just difficult living in the world right now. And it's also important to think that it's not just more seasoned professionals who experience burnout. People who are brand new to the field can also experience burnout. It's not as if it's due to time in your position or time within your organization. Brand new practitioners can experience burnout after just a little bit of time. So it's not really about years of exposure. It's just about the situation that you're dealing with. I keep going, right, Nan? I think so.
Yep, you keep going.
Okay. So there is a lot that organizations can do to address the issue of compassion fatigue, and we will be getting to the good news with all of our self-care strategies in just a minute. So it's really important that the staff members who work within the organization, that they know, that they feel as if that the organization values their opinion, is concerned for their well-being. It's important that agencies acknowledge the challenges of doing the type of work that we're doing, and help to alleviate the stigma and the discomfort for those staff who are experiencing issues of compassion fatigue. Other things that agencies can do, and a lot of this is easier said than done, but it's still worth mentioning, is make the discussion of self-care a regular topic, something that is regularly discussed. You can teach by doing. So if you, as a supervisor are practicing good self-care, you're modeling that for your supervisees and for your colleagues. So if they see you taking good care of yourself, it's more likely the case that they'll follow suit. And it's just also important just to be aware and to make available educational opportunities, professional development opportunities that really focus on the warning signs of some of the issues that Nancy described and coping strategies for how to do the work without compassion fatigue and burnout impacting you negatively. So our colleagues at the Central East Addiction Technology Transfer Center developed a self-care curriculum, oh gosh, probably about 13 or maybe even more than that, 15 years ago, maybe not quite that long. But they have a curriculum on self-care strategies, and in that is a worksheet that they developed, and it's really looking at the 8 domains of wellness. So if you think about wellness and you think about the sort of the whole person, you've got, it's not just a physical wellness, right? You've got your emotional wellness, financial wellness, intellectual wellness, social wellness. And this workplace scan is something that you can do on your own. So basically what you do with this is you look at each of the example statements and you score yourself on a scale of 1 to 10, with 1 being low and 10 being high. So for example, if you look at the emotional wellness domain or dimension, to what extent do you feel confident that you can manage daily stress? So you score yourself on a scale of 1 to 10, or to what extent do you feel supported by your coworkers? So you follow through to the 8 different domains, and essentially sort of a lower level of wellness would be a low score of 1 to 3. A moderate level of wellness in a particular domain would be a score of 4 to 7, and a higher level of wellness would be a score of like 8 to 10. And what this allows you to do is it allows you to see where the work can be done. So, is there work to do in your physical wellness, or is there work to do in your spiritual wellness? And so this is a tool that you could use for yourself. You could use it with your patients. It can be done in a staff in service with your colleagues. But it's important to really keep in mind sort of that whole person, holistic approach of wellness. It's not just one domain. All these domains are equally important. So some of the things in looking across agencies to see things that work well with regards to addressing compassion fatigue, here are just some of the things that we've noticed that result in a reduction in compassion fatigue, whether it's good, high-quality clinical supervision. Just providing supervision isn't enough. It has to be constructive and it has to be effective. Providing personal development opportunities, flexible schedules. I know that many of us, when we were forced to move from an office into our homes to do our work, schedules got flexible, just sort of because they had to. And so allowing there to be flexibility in a person's schedule really can result in just better wellness overall. And then, of course, wellness incentives, whether your place of employment offers rebates for joining a gym or for riding your bike to work instead of driving a car, or doing other types of shared riding or walking or using the bus, whatever the case may be. It's important. We're going to close out this piece of the conversation and move on to self-care, but it's just important to really just to be aware about the impacts of compassion fatigue, recognize the importance of providing opportunities for your employees to get the resources that they need to reduce the impact of the compassion fatigue they're experiencing. And then the slide has some other things that are equally important. This slide is based on a study that looked at counselors who were working in an opioid treatment program. So this is a specific modality of care. Other ways, it's narcotic treatment program or methadone program, some people call. And it was looking at things that could help to reduce workplace stress. And so the black text is some of those activities that were shown to reduce workplace stress. Having improved communication, giving accessible paid time off, and supervision. So we see some common themes arising throughout the slides, and it's just things that have been shown over and over to really help to reduce stress and to reduce the impact of compassion fatigue. If we were to have the opportunity to do some kind of polling with you all, we could ask you what kinds of emotions you're experiencing just being present today, doing the work that you're doing. These are some of the more common things we hear from folks, and they're all negative, right? So being frustrated, or feeling confident, or feeling like you're a failure, or feeling vulnerable. And so what we want to do is we want to shift the focus away from the negative and think about ways that we can improve the experience, the clinical experience, so that when you ask a person what emotions they're experiencing, we get a very different list of emotions. So I'm going to turn it back over to Nancy, and she's going to start to walk us through some of the self-care strategies that we've identified as being important.
Thanks, Beth. I think, it was really helpful to hear about what happens at the organizational level and to remind people about the term burnout and some of the new research that's going on regarding burnout, like you mentioned. When we talk about self-care, we want to make sure that we're promoting people taking good care of themselves, and that we're not shaming people or doing finger wagging. Beth and I talk about this, like you've got to take good care of yourself. Like, that's not helpful. So Beth and I looked at the literature, and we came up with 5 tips that people can use. So let's talk about self-care and the definition. Once again, the dictionary says self-care is the practice of taking action to preserve or improve one's own health, well-being, and happiness, particularly during periods of stress, which certainly during the public health emergency that we're all going through right now, we can certainly count that as a period of stress. And so we want to, self-care helps us limit negative outcomes by guarding against issues. It helps us cope with and reduce stress. It promotes broad positive outcomes. And self-care is about taking proactive steps to enhance our resilience and our overall well-being. And so when we think about this, I really like the last bullet. It's about taking proactive steps. And next slide. And so that's what we're going to talk about. This is a great quote from Butler, and hopefully any of you that have flown on planes, you get to hear the flight attendants talking about, and if in case there's an emergency, you should put your own mask on first before you help others. And so really that's a nice kind of reminder about self-care. Like, we've got to take care of ourselves so that we can help other people. Next slide. So tip 1, be open to learning new skills. Certainly during the public health emergency, and certainly for behavioral health practitioners and clinicians, we've had to learn a lot of new skills. And so learning new skills or ways to do your job is always difficult, but and during the public health emergency it can be harder. But let's look at dividing the new skills into smaller and manageable tasks. Reflect on what you've learned and what you still will need to accomplish. And don't learn alone. Learn with other people. Ask for guidance, ask for help, ask for feedback. Next slide. Let's talk about learning new skills in terms of telehealth. And when I talk about telehealth, I'm talking about video conferencing in the form of synchronous live video and audio. We know that it's effective. We know it's well received by patients. And it's a standard way to practice for many behavioral health practitioners. It may just be new to you or your agency. And so make sure that you understand that video conferencing has been around for a long time, especially in mental health. service delivery. It's newer in substance use service delivery, but the research is strong for all forms of behavioral health services, and that empathy does translate through technology and allows for the development of therapeutic relationships. And I point this out because we do a lot of training and work, and there's a trainer that I've done a lot of presentations with, and I've never met her in person. And yet we train together, we are colleagues, we have developed a very effective working relationship, and we laugh and say one of these days we'll meet each other in person. And the other thing about learning new skills is practice, practice, practice. And that the more practice you do, for example, regarding the use of video conferencing, the better you'll get at it. Next slide. So give yourself permission to get more comfortable with having hybrid relationships. And all the literature that Beth and I have looked at recently shows that most experts are saying that post-pandemic, or post-public health emergency, that we're going to have these hybrid relationships with patients, or if you're doing peer recovery support services with peers. So think about that in those terms of, gosh, sometimes I'm going to see my client in person, sometimes I'm going to be on video with them, sometimes I'm going to be doing phone consults. Those are the things we have to think about. Also, videos and fact sheets are available to help develop your skills. And you can see here it's from the American Psychological Association and the American Telemedicine Association have best practice guidelines. We have those links for you at the end of the presentation. And then the Center of Excellence on Private Health Information has great handouts and tips and a little video for clients or patients, and we have that link as well. And then just keep in mind, while the Office for Civil Rights gave notice about enforcement discretion, meaning it allows a wider use of different types of video conferencing platforms, we have to remember to always act in the best interest of our patient and to initiate and implement virtual services following stricter guidelines, probably at when the public health emergency is over. Next slide. Second tip, practice self-compassion, and this one is really important as well. It's talking about self-compassion, like being kind to yourself. So extending kindness and understanding to yourself rather than judging yourself harshly, seeing your experiences as part of a larger human experience, so that, man, I'm part of a movement to provide services to patients with behavioral health related problems during this most difficult time, and then holding one's painful thoughts and feelings in balance awareness rather than over-identifying with them in mindfulness. And Beth will be talking about that coming up. All these components interact to foster compassion, focused inward. Next slide. And so a lot of people go, oh, if I'm doing self-care or self-compassion, I'm being selfish or self-centered. It's not. Okay, so this little logo or image that you can see, it says self-care isn't selfish. And so what we want to do is cultivate self-compassion. And it's really been shown to stimulate brain activity that invokes empathy and compassion for others and ourselves as well. Next slide. So tip 3, what we suggest is that you develop a self-care plan that includes exercise, nutrition, sleep, creative endeavors, spiritual activities, and social support. And the 3 coping strategies have been found to help social workers manage compassion fatigue. This is a new study out in 2020. They found to have a clear self-care plan, participate in activities or hobbies that restore energy, not take away energy, and have a work-to-home transition plan. This is really interesting because if you think about it, before the public health emergency, many people have a drive or they have to take public transportation from their work site to home, and so they would do sort of a debriefing. And now if we're working in our home, how do we change? How do we move from work mode to home mode? And so think about a transition plan that you can put in place in your home, and see if you can put a plan in place quickly. And even if you can't, it's okay. Just look at these aspects to what's involved in a self-care plan. Next slide. So one of the interesting pieces we want to remind folks is that currently behavioral health professionals and students need to be aware of their obligation to participate in self-care. So do you have an ethical duty to take care of yourself so that you can provide effective services? Do you know what your ethical code says about either specifically or indirectly about self-care? And does your profession's ethical code mandate that you assist colleagues who may be suffering from compassion fatigue, or as Forrester called it, moral stress? Next slide. So interesting, the American Nursing Association Code of Ethics for Nurses, which is kind of an interesting point, says the nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness and character, integrity, and maintain competence, and continue personal and professional growth. So it's like all the things we ask our patients, our clients to do, we should ask of ourselves. And it's all about self-care. Next slide. Beth, I think this is you.
Yep, it is. Thanks, Nancy. So self-care really is not complicated. I like this image because it has it's 50 ways that you can take a break. And I know for me personally, when we were thrust into the Safer at Home order, and we really weren't supposed to be going anywhere. And so one of the things that my family did after work each day is we took a family walk with our dog. And it was a long walk every day because we didn't have, the kids didn't have any activities. And, you know, once the workday was over, it was really a matter of just having some time that we weren't used to having in our schedules. And so every day we went for a family walk. And I'll tell you, I got to see parts of my neighborhood that I've never seen before because every day we would pick a different route. We're lucky to live in a walking community, and so there's lots of different places for us to walk. And it was just quite beautiful to be out in nature and to be breathing fresh air and to, you know, have conversations with the kids when they were done with virtual school for the day. So these are just some ideas, you know, these are just some ideas that you can consider. They're all, for the most part, free and easy to access because a lot of it just has to do with you, like, you know, dancing in your kitchen or, like, taking a bike ride or petting your cat or your dog. And so just things to consider, but it doesn't have to be complicated. Speaking of pets, there is research that shows that watching videos of, you know, the grumpy cat or funny dog videos really is good for you. There was, I know in the part of the country where I live, there was a huge increase in pet adoptions in the spring because people were home. People were home. They weren't going into work. They were home, and they were like, oh, now's a good time, you know, to adopt a dog or to adopt a cat. And so just, you know, it's just another way, like, you know, spending time with pets can be another way for self-care for you. So going back to our top 5 tips, tip number 4 is to try a little mindfulness. When we were getting ready to start this presentation, we were talking with Carrie, and she was mentioning how she just did a training with youth in Nigeria, and she taught them mindfulness techniques. Mindfulness techniques are a tool that anybody can use. Kids can use, adults can use, professional, you know, it really doesn't matter who you are because mindfulness is all about a state of being present or being aware without sort of all the external influences that impact you. There's a lot of research looking at the benefits of mindfulness training, helping in areas of reducing stress. It's linked with a clinician's ability to know when to take time away, take a step back, practice some good self-care. And it really is a protective factor. And it's not incredibly difficult, although a lot of folks do struggle with how to start a mindfulness practice. So these are just 10 very practical things that you could do during your work hours. So if you're still going into an office or a clinic, you can do these at work. If your work has taken you into your home, you can do these things at home. My personal favorite of the top 10 of these 10 mindfulness techniques is take lunch to eat lunch. The world is not going to end if you take 10 minutes to eat a sandwich. And for me, with working at home and being completely overscheduled, there's days where I have 6 Zoom meetings in a row, like literally. I go for 6 consecutive hours without a minute to take a breath. So I end up being late to a meeting in order to be able to eat lunch or to go to the bathroom even. And so taking time to eat lunch, it takes you away from work. It takes you away from that just mind-numbing meeting marathon that we've all been experiencing lately. And, you need food to nourish you and to allow you to be productive employees. And so eat that sandwich. Take a few minutes to nourish your body. It'll help to nourish your brain for sure. The UC Berkeley has something called they operate the Greater Good Science Center. It's an amazing resource. They do a lot of work around the psychology of happiness and self-care and just the importance of mindfulness. And on their website, they have a whole section where you can download very short video clips that are mindfulness meditation practices. And so depending on what you're looking for, you can download these short video clips, and it can help to sort of get you started if you don't know where to begin. So the next couple of slides look at the connection between how mindfulness and self-compassion really do go hand in hand and work together. So this slide just shows you, how the two concepts interplay with one another. So, for example, recognizing that you're part of a common humanity, that's one of the elements of self-compassion that Nancy mentioned. Having an awareness of your thoughts is mindfulness, and sort of it goes in a cycle. So it's all interconnected. This mindfulness, practicing good mindfulness, and also having self-compassion. So those two things together, self-compassion and mindfulness, can really lead to good emotional well-being outcomes. And so they play into one another. They're sort of like inextricable, and they help to result in just better wellness outcomes overall. Our final tip in the top 5 tips for self-care is really to promote hope and community. Things are going to get better, and I have been working really hard both with my team at work at UCLA as well as with my family, my kids, my husband, to be optimistic. It's so easy for us all to sit here and feel sorry for ourselves. We haven't gotten to travel. We didn't get to see our families for Thanksgiving. We're not able to we're not able to move freely in the world the way that we were used to prior to March. It is going to get better. Like, there is a light at the end of the tunnel, and I've been trying really hard to use positive and optimistic language because feeling sorry for myself is just not cutting it. It's just not working. And so hope is a real thing. It's one of SAMHSA's 10 guiding recovery principles. It's mentioned in the big book 43 times. So just keeping in mind that there is hope that things will improve, and not forgetting that you're part of this larger community. It's just a couple of things just to keep in the back of your mind. So in summary, our top 5 tips are listed here. If we want you to remember anything, we want you to remember these top 5 tips because they really can help to guide you along a journey of instituting a good self-care plan or having self-compassion or trying a little mindfulness. So we encourage you to keep these in mind, and you can even print this out. You can share it with your patients. You can put it on your desk. You can do whatever you'd like with it. But we thought just giving you just a few things to keep in mind would be a good place to start. You're worth it. It's important. It's necessary, and it's really critical to make that time for self-care. And it's not a one-size-fits-all approach. Not everything works for everyone, right? So what you need to do is, on your own self-care journey, is find what works for you. And guess what? Once you find that, do it. And if it's something, if what works for you is not what works for your husband or for your sister or for your patients, so be it. They'll find what works for them. It's really about honoring that commitment to finding what does work, just so that you have an overall better, just more positive outlook, and just you'll have a greater sense of well-being if you can do that. So Carrie, I'm not sure if any questions have come in to.
I know I have some questions and comments and some other things. So first of all, thank you, both of you. That was really excellent. I know as someone who's very interested in this topic, I learned some new things. I guess I was hoping to have a conversation in terms of like organizational culture with this, because you guys talked about that really appropriately. But I know myself, like I was in a nonprofit and I was in a leadership role, and I was given some level of at least tacit support to do some self-care projects with our practitioners. And I used to do a weekly yoga class because I'm a yoga teacher. So I would teach it for free, and I would actually walk around and be like, hey, we're starting yoga. Hey, it's time for yoga. And I would have counselors who would say, my manager will be like, that's not a billable hour. Or, are you, would have concerns about, getting everything done and things like that. So I guess I was just wondering if you guys have any ideas in terms of, obviously you talked about how much more productive people are when they do self-care, but I mean, we're talking about 1 hour a week, and yet there was pushback about it. So what thoughts do you have?
Well, I think a couple things. One is, I think for some people, yoga can be intimidating, and so maybe some of the pushback, could be like, oh my God, I'm not very limber, or I feel uncomfortable with doing that. And so reassuring folks, newcomers to yoga, that they don't have to be perfect. And I think yoga is also perfect for that, because it's a reminder that everybody goes at their own speed, and there's no expectations, and it's also up to the instructor to give that message. So I think that's part of the pushback. I also think people get that rigidity that says, oh my God, don't change anything because everything is changing in my life. And so that giving up, making this shift to yoga once a week, oh my God, you're asking for one more thing. And I really think it has to come from the top down and the bottom up. And I think you have to get the head person, the CEO, whomever, going, I'm going to yoga, come with me.
Right.
And I'm sure you did that as well. And hopefully, talk about it in the senior staff meetings and things along that line. And I also think it's helpful to point out, like, what's the rigidity about, or planning another thing, like I'm going for a walk, and so once a week it's a walk or yoga, so you have two choices. And so, or we have like a funny video time, or we do something, because I think where we get stuck is one person's self-care is not another person's self-care. And so how do you do that for an organization where you offer a variety of self-care activities? And then the scheduling becomes difficult with that.
Sure.
I don't know, does that make sense, Carrie?
Yeah, no, those are great points. And that certainly, since I was in a leadership role and I was pushing it, there could have been some like, oh no, I'm not allowed, I can't, if they were uncomfortable. That's a really good point.
Right. I don't know, Beth, do you have comments on that?
Yeah, my comment is a little more general, is it definitely is a shift in mindset. And, you know, in so many places, nonprofit organizations, even places like where I work at UCLA, you know, if we're not out there making new relationships and trying to bring in funding for training and technical assistance, my team doesn't have a job. And so for us, like, because I feel so strongly about the importance of self-care, there's been a lot that I've done. You know, I'm lucky to be in a leadership position, so I can make decisions around the use of my staff's time. And it was a huge shift in mindset to allow time for stuff that wasn't work-related. And we've done a lot since the spring to engage our team, because now our whole team of 20 is working from home. So they're not interacting in person the way that they're used to. And like myself and my boss, thought it was really important to set aside and honor time to check in with folks, to see how they were doing, to get to know them in a non-work related way. And I tell you, it was, you know, because we've got so much we need to accomplish in the meetings that we have, you know, even just our weekly staff, like, team huddles, it took a while for us to get used to spending time not talking about work. And it was a big shift in mindset that, you know, getting to know our team members and supporting our team members and checking in with them to make sure that they were doing okay is as important as the work stuff. It just is a shift in mindset, and I think that's one of the more, like, generic, general things to think about for organizations is it's a shift in mindset that you have to commit to, and then you got to stick with it. It's not just this, like, fleeting thing that happens every now and then. Like, you shift that mindset, it goes from the top down and the bottom up, and it becomes a new culture. So that's my comment on that.
One of my staff, great points. One of my staff just started with her 3 or 4 supervisees. She has weekly a quarantine cafe.
Oh.
And so, and it's like Beth said, it's a check-in time, so it's, you know, some work conversation, but typically people have coffee, tea, some kind of, you know, beverage, and it's more casual talk. And I ran it for her when she was off, and they're like, I go, well, what do you guys do? Because I didn't know what they did. And they're like, well, we talk about what binge watching shows we have seen, you know, and it's like, oh my God, really? And so I had to take a deep breath, and I'm like, so what are you guys watching? You know, and so I had to join in a different way. And so they do this weekly as at the end of sort of check-in supervision, not clinical supervision, but, you know, it's great. I thought it was a great idea. It's a very casual way. And, you know, they have certain things they discuss every week that are fun things.
Yeah. Well, I want to thank you both for your time. So wonderful. I'm excited that we got to have this today, and I'm sure we'll collaborate more in the future. And I will be posting this recording so people in the future who weren't able to join us will be able to see it. And thanks again.
Sure. Hey, Terry and Beth, could you go to the resources so we show people really quickly what's available?
Absolutely. So we do have some resources linked directly into the presentation. These are things that have been developed by the ATTC network. We're at the top because we should be. But there's a lot of good resources in the realm of compassion, fatigue, and self-care. These are some of the more recent articles that Nancy and I cited in the presentation that are all available in, they're open source, and so you can just click on the link and get access to the full article. SAMHSA has got a compassion fatigue tip sheet that you can download and check out. And then this is us. So if there's specific questions you think of once today's session is over, we're only an email away. and we encourage you all to reach out. And Carrie, thank you so much. I'm glad we finally got to do this. And
Me too.
Keep us in mind for future opportunities.
Yep.
We sure will. Thank you so much, and have a great rest of your day.
Great.
Thank you too.
All right. Bye-bye.
Bye.